So today we're going to be talking about some of the causes for testosterone deficiency. Now, first, I think some people think about testosterone deficiency just creeping in slowly over time and it becoming something that's quite insidious, and just something that's definitely going to happen. For other people, it becomes much more problematic, and actually they really start struggling with symptoms, and we're not really sure about what it is that's causing this these days, are we?
Yeah, for sure. The first point you make about that insidious process, that very much is a thing. We know that past the age of 30, your testosterone levels can drop by 1 to 2% per year.
Yeah.
And there's genetic variation in that. And, there's studies on this androgen deficiency in the aging male. There's huge studies on this that demonstrate that.
Was it Forbes that did that article, which is really damning? It said something like, what was it? I think it's entitled, "You're Not the Man Your Father Was."
Yeah.
Like,
now, that was interesting because that was relating to the average male testosterone levels of the time.
Yeah.
And then how that's changed over time. And, it's so multifactorial, isn't it? You can get into the fact that probably the main issue is the level of obesity in the male population, not just in the UK. This is seen in the US as well. In particular, I've discussed this with other people in the field that work in this field in America. And they actually, I don't know if people have seen, but they've created a new category of obesity called super obesity, which is after morbids. So, and that's how big a problem this is getting. That's probably one of the main reasons that's contributing to those lower normal, in inverted comma, levels, which that article was referring to. And it definitely age is a thing. Obviously, increased ratio of fat to muscle tissue on your frame is another factor, because we know that aromatase, the enzyme that converts testosterone into estradiol, is synthesized in fat cells. So if you carry more of those and less muscle, then you're going to have a higher estradiol to testosterone balance or ratio, and we call that the T to E ratio. So that's a factor as well. Then you've got just overall health of population. So we are a very sedentary population now. You're in the upper 5% apparently, according to something I was reading the other day, if you exercise regularly, and that's such a damning, concerning thing to read. And then of course you've got other factors such as you've got iatrogenic. There are people that are on drugs that are they need for other things. Or they have other comorbidities like metabolic syndrome, so they have diabetes that can impact your testosterone levels. Iatrogenic meaning that it's caused by a medicine that's unintended, that you're treating something else with and then of course you've got this, and this is a big can of worms, endocrine disrupting compounds, like so EDCs. There's so many chemicals nowadays in all of the things that we consume, and this is what
many unknown unknowns.
This is it, and this is what leads to people trying to go back to, and people might view these people as extremists or outliers, trying to go back to living our life in a way that we used to before we had access to all of these things that make our lives so convenient.
Which is almost impossible to do.
Exactly, yeah. So I have a friend actually who's trying to live plastic free, and it's an admirable thing to do, but the lengths to which they go to do this is unbelievably hard, and in no way means that you can live your life and quote unquote normally, because we've become so interdependent on the things we need to live our daily lives that may contain these endocrine disrupting compounds like plastic. And
even in the way our foods are contained at various points in their processing, but also in certainly in our meat, you kind of think about the hormones that are introduced and at what stages, be it medical treatment for them, and and it's just so hard. We are so far, a lot of us anyway, the majority of us I would say, are so far away from our food sources, from being continually in touch with them from beginning to end, so to speak.
Exactly, so it goes back to that sort of thing, like where how far do you go with that? Like do you go down the organic routes? Do you go local because where the origin point, how the animal was slaughtered, if it's meat, how the vegetables were grown, was there a lack of pesticides? Do you grow your own? Do you have your own animals in your own abattoir?
Control if you do grow your own.
Exactly,
as well. Actually...
Like how do you do you go all natural? That's the only surefire way of reducing EDCs is to do everything yourself, because you and only you know what has gone into what you've got on your plate. And then the plate itself, like where was that made? How was that made? It's so difficult, isn't it? Like, do you only use bamboo for everything? Like it's it's such a difficult thing to navigate because of, like you said, these unknown unknowns. Like, and then people don't realize, like, that things that they do daily, like putting antiperspirant on, putting another fragrance on, lots of endocrine disrupting compounds in those. Now, what impact do they have? Yeah, in water, exactly. Treated water. It's a privilege to be able to go to the tap and have access to clean water, because some people in the world don't have that. But at the same time,
don't know what you're getting with it.
What went into that to get it to the point where you can put it in a glass in your house? Like, it's we're at risk of sounding like a conspiracy theorist here. Like, I don't mean to come across like that, but it is a very valid point that there are so many things that disrupt our natural synthesis of hormones that it makes it actually very difficult to not be deficient, because age is the one, like that we cannot outrun that one. Everybody ages, and then we have add in all these other factors, and we are it's like we're almost doomed to getting to that point. And
there are other sort of natural processes that happen as well. So, I mean, we know that actually a man's testosterone level will drop off if he's cohabiting with a partner who's had a baby.
Yes.
During, I think it's a good 12 to 18 months, I believe.
It is,
isn't it?
yeah. So, but in the first 90 days, so around 12 weeks, there's an interesting increase in oxytocin. Now, there's lots of theories posited in the literature as to why this happens, with the main one being from evolutionary biology, whereby the testosterone drops and the oxytocin increases to ensure that the male stays. So this goes right back. It's a throwback right in terms of evolution to other species in the animal kingdom that are typically known to be what are called induced ovulators. So the main one that comes to mind is deer. Red deer in this country, in the UK, typically have one patriarch and then a harem of females. And they are what are called induced ovulators. So when they have a season, they will release an egg anytime they're mated with. Now, when you look at the blood tests from studies that are done on them, they don't have an increase in oxytocin, and they don't have a decrease in testosterone.
That's some really niche knowledge.
And it's because it's because they need to mate with multiple females. And they aren't responsible for rearing, which is something that is different in primates. So you see this same testosterone drop and oxytocin increase in more developed primates like bonobo chimpanzees and in orangutans as well.
Really?
Yeah.
I did not know.
Yeah, there's a really interesting book called Testosterone. I'll flash up a link in the screen. I forget the lady's name, but I actually watched a presentation of hers online that was very interesting, and all of her studies on testosterone were done with bonobo chimpanzees.
Really? Oh, well, who knew?
Yeah.
I think I don't know. It's interesting though, because you can feel quite out of control of so many of the variables, and to be fair, like you are, the majority of people are and don't have the time, the effort, or the resources to actually put into it. And I think you could drive yourself a bit crazy, but sort of thinking about all of it. But even to I mean, I think there have been some military research that have been looking into some poor nods that have been put through some horrible stuff, going through marine training, and looking at their testosterone levels dropping off over time. And I think that's more through sort of arduous activity and thing. But you also think about men in, sort of all male environments where it's been quite a competitive environment. And you kind of wonder whether or not actually that might have had an impact as well.
Yeah.
So taking that and looking at what's happened with work environments and more people working from home, and actually that sort of less of a stimulus, I wonder, and I don't see there being any way of really properly being able to control for it, but I do wonder whether or not that might also have an impact at some point.
Well, definitely. Like so there's a theory that because what you talk about there is stress response. Like so if you're in a constant state of fight or flight, there's a theory called the cortisol steal theory when it comes to hormone regulation. This is talked about quite a lot in female HRT actually. and not so much mentioned in male hormone replacement therapy, but I think is transferable to both because the physiological response is the same.
Yeah.
So with rising cortisol, you get a steal, as in it's robbed of your other androgen or sex hormones. So obviously estradiol being the primary one for women, but testosterone being the primary androgenic hormone for men. Now, this is hotly debated in the HRT world because there's some people believe that it doesn't exist at all. And there's some people, and I include myself in this, that do believe that it has physiological grounds because it makes sense. And it's like when you talk about a true adrenal crisis versus adrenal fatigue, and that's another hotly debated topic in the medical field. And you'll get some people that are stalwart that adrenal fatigue is a thing, and some people that are endocrinologists like it just isn't a thing. Whereas adrenal crisis very much is a thing that can be fatal for people, and I see in the emergency room from time to time. But the cortisol steal theory and its association with stressed or long stress environments, like working in the armed forces, or like being in a work environment where you are constantly either harassed, bullied, or you just have a massive amount of responsibility. It very much, to me, makes sense that if your cortisol is chronically high, then that will contribute to hormone deficiency for sure.
Over a protracted period of time. But do you think that equally the right level of stress can actually mean that you can upregulate for a period of time?
Yeah, for sure. So I think that's so what you're talking about there is the difference between eustress and distress, isn't it? Like so distress being too much of a stressful experience, and eustress being normal baseline stress. So U is like when we talk about eugonadal states. So eustress would be what would be considered a normal amount of stress response to a given situation, and that can temporarily and weight training is a great example of this, and this isn't put in the scientific literature, where your testosterone levels temporarily increase through heavy lifting. So there's lots of literature out there about guys, or any athletes regardless of gender, doing resistance training and having their pre and post testosterone levels measured, and then being at a certain level pre-lift, and then post a training session being temporarily higher, then going back to baseline. And that's because there is that correct level of stress that isn't prolonged over time that causes them to be pushed down. It actually elevates in response to the stimulus that you're giving it.
So I don't know. I mean, I think the cause, I suppose, for the reason now that you see guys coming in with testosterone deficiency, we're never really going to know, certainly not at the moment, what all the individual causes were. But I think it's likely to be. I mean, it's one of those things that people always say when they don't know the answer to the question. They're like multifactorial.
Yeah, exactly. And I think that's a really good point though, because we like to categorize things in medicine, don't we? So we like to say, is it primary, is it secondary, is it tertiary? And very often I end up writing it's mixed, because you have elements of especially primary and secondary, because when you've got an obvious prolactinoma and a very very raised prolactin, and therefore a squashed testosterone, that's easy to diagnose. It's very much there it is, and then you confirm with MRI, and then there's a pituitary adenoma present. But when you've got elements of, say, of a slightly elevated luteinizing hormone, one of your gonadotropins, but a normal FSH, but a very low total and free testosterone, that isn't, and that makes people nervous about diagnosing testosterone deficiency, despite the fact that it may be below 12 nanomoles per litre for the total, or below 0.220 nanomoles for the free. That technically is testosterone deficiency, and especially if proven over time with confirmatory testing. But the fact that you don't have that either, both the FSH and LH are skyrocketed, and you're like, this is a primary testicular issue. Or you don't have evidence of a secondary disorder through clear history, it can make people nervous about commencing TRT. And I think, saying multifactorial is a cop-out, it is something that people discuss and sort of, laugh a bit about. But it is often the case. We may never find the cause, and that to me, if you want to give it a medical terminology, would be idiopathic hypogonadism, because their levels are low, but we don't know why it's occurring, but they still have the symptoms that need help with, and it needs treating. Exactly. Absolutely. It shouldn't be a barrier just because you can't classify it.
No, completely agree.